I'm State Senator Lakesia Collins of the 5th Senate District. That's the West Side, near West Side, and then North Side. Former healthcare worker, mother of three. I'm a Chicago native, and I'm joined here today with my colleagues in the Senate, two dynamic women who I enjoy working with. Leader Hunter, would you like to introduce yourself?
Yes, I will. Thank you so very much, Senator Collins. It's a pleasure to be here on this podcast to discuss some very important issues that impact our community greatly. Mattie Hunter, State Senator. I've served since 2003. I'm from Chicago, and I have a very diverse district. My district goes from the Gold Coast to what they call the Soul Coast, and so which means I have Inglewood, Washington Park, Bronzeville, parts of River West, parts of River North, South Loop. And so it's quite a diverse district. And then we're very proud of representing those people down there.
Thank you for your service.
Thank you.
Senator Turner, would you like to introduce yourself?
I would. And I'm very excited to be here with you all talking about Black health during Black History Month.
Mm-hmm.
I represent the 48th District, which is not in Chicago. It's a little bit in the central part of the state. So I have Sangamon and Macon counties. I've been in the state senate since February of 21. So I'm, a newcomer up against Senator Hunter.
One of our neophytes.
Yeah, but prior to coming into the Senate, I was on the Sangamon County Board and also on the Springfield City Councils. But I also worked for the Illinois Department of Public Health as chief of the Center for Minority Health Services. So minority health and making sure that our communities of color receive the best possible health care services that they can get is something that I'm very, very interested in and have really tried to bring that to my work in the Senate.
So it is Black History Month. There is still inequality when it comes to healthcare and, women's health, reproductive health. And so I'll kick it off. Black women, we often experience persistent healthcare disparities when seeking maternal fetal care. And some of the challenges that women are facing today and still face today, we've done a lot of work here in the state of Illinois, right? And so we know that Black women continue to face higher maternal mortality rates, delayed diagnosis, and unequal access to quality prenatal care. And a lot of that is due to systemic racism, provider biases, gaps in insurance coverage that contribute to these outcomes. And there was something really big that we did this past session, 24, which was passed House Bill 5142, the birth equity bill, which I had the pleasure of sponsoring, leading in the Senate. And I couldn't have done that without you all's support, right? And so that bill strengthens a lot of the healthcare coverage standards for pregnancy and postpartum care. It includes postpartum services, supports like lactation-related care, and prenatal supports. I think we have also like an earned income tax increase in there, and it addressed diaper needs, which is something that the federal government doesn't even see as a necessity, but it is. And it's not just in Chicago, but it's also in rural communities too.
Right.
So, Senator Turner, what are some of the things that you see that we still face today?
I think that we've done a lot of real work in the legislature to address some of these issues. But I also think that, of course, there's still work to be done because we have to look at health from a totality of the situation and not just healthcare. I mean, we have to, and I'm really glad that you brought up the issue about Chicago, not just Chicago, but also our rural communities, because we see pockets of downstate in our rural communities where the disparities are extremely, extremely large. There's we have to talk about access to healthcare. Are there physicians that are available? Are there pharmacies that are available? Are there long-term care facilities and hospitals that are that are available. So we can have the best possible healthcare, the best possible, legislation and policies in place. But if people can't get to those services,
Right.
that's a whole another issue. So I'm really proud of some of the work that we have done around that. But of course, there's still a lot of that work that needs to be done as well.
Being a healthcare champion yourself, Leader Hunter, I know I used to come down here to Springfield a lot and talk to you about nursing home workers and things of that nature. But I know that you also helped to spearhead, one of the pillars for the Illinois Legislative Black Caucus. Can you talk about some of the work that you've done and also like some of the disparities that you still see today that show up?
Yeah, that's a very good question, Senator Collins. So, over the years that I've served here, I passed a number of pieces of legislation that addresses the disparity issue, but they weren't comprehensive, like in terms of a big package, that it addressed some of those issues, but not until 2021 when the Illinois Legislative Black Caucus came together. We sat down with one of the House members, Representative Leader Camille Lilly, and we got together, and we got together also with members of the Black Caucus, and we came up with 4 pillars. Okay, and and we looked at globally. Globally, we looked at the issues that face the Black community. And so I know that this session deals with health, but we looked at criminal justice, education, public health, and I believe it was employment. Okay.
Mm-hmm.
And so Representative Lilly and I were given the task of addressing the health and human services issues. And so that was in 2021. And we passed this huge bill. Okay. And it addressed systemic racism in Illinois and the areas of those areas that I discussed: criminal justice, economic opportunity, education, and healthcare. And so the 4th pillar was the first major reform to Illinois healthcare system in probably a decade. Okay. And it was so resounding that we were getting calls from our colleagues all over the country. How did y'all do that? We need that here in our state, And so we were sending the information and sharing so that other states can address some of these issues. And so what we've done within that system is that we created a safety net hospital grant program of $50 million, and it's subject to appropriation, but to preserve and enhance the OB-GYN services, because so many of our and also the specialty care services at those receiving hospitals, because now you got a situation where hospitals are closing their OB-GYN departments.
Yeah.
So that is further impacting the issues as it relates to this pillar, and of course it has a systemic. It trickles down. And so normally people would go to their neighborhood hospital to have a baby. Well, if their OB-GYN unit is closed and shut down, they have to go downtown or rural areas. They have to travel 50 miles, 100 miles. So it's very problematic, actually. But we also required the Department of Human Services to update the Child Care Assistance Program, their eligibility calculator, in terms of how do they determine what the family really needs for applying for the child care assistance. That was for the first time for more recommendations, more redeterminations. And then it also required prenatal doula service, the doula service, which is huge now. And it came in right on time, actually, And so I was meeting different women who provide doula services, and it reminded me of my 3 last siblings, the younger ones, where I actually assisted as a child. I assisted. I mean, I was like 5 and 6 years old. When I say a child, 5 or 6 years old. And I assisted my mother and my grandmother
Would deliver.
with delivering my siblings.
Oh wow! And you see the smile on your face.
Just thinking about that.
Yes, it is a hot topic because I hear about it a lot, and I think again, like the work that we've done here in Illinois, and working with leaders like yourself who have that background, that history, and that lived experience, really helped to usher that through. Then also having an administration, right? Our governor who has supported a lot of these efforts unapologetically has been really helpful for us. When we
one of the things that is really interesting and impactful for me is because when I came into the Senate, it was on the tail end of the pillars.
Oh, okay.
Because it was February of 21, so I wasn't here to actually be part of
The development.
and all of that, but I was here to vote.
Well, that's what we.
I was here to vote and also to stand with you all and Governor Pritzker when he signed the healthcare pillar into law, and then to see some of the pieces of that actually come to fruition in my community, because actually Sangamon County Health Department started a new doula program. And so to actually be there to see the inception of that, and I also sit on the Sangamon County Board of Health, so every month to hear how impactful that program is, it really speaks to the work that we do here, and how it's not just putting words on paper and voting them into law, but to see how impactful they are to our communities.
Yes.
Because when you talked about the services that some hospitals have that they're closing.
Yes.
I see that in my district because it's almost to the point where, so I have Springfield and Decatur, and those communities are about 20, 30 miles apart. And with the closure of some OB-GYN areas in hospitals, there are some people that may be in a situation where they have to travel from Decatur to Springfield.
That's right.
And that's not just, going to another hospital. You got to think about transportation. You have to think about if you have other kids, babysitter,
healthcare issues,
all of those kinds of things.
Of course.
So the work that we do here is really very impactful on a real human everyday level. And I don't think we could ever lose sight of that.
Well, see, that's the beauty of this job. It's when we identify an issue that exists in our community, we come back over here to the Capitol and we start talking to our staff, and someone puts together some legislation. We have hearings, you get involved with the process. You have the community people to come in and testify about their experiences and what the needs are, and they're educating us as legislators because some of us don't even know,
Right.
I mean, I'm from the city and you're in the central and rural part of the state, and so folks up in Chicago or in an urban setting, most of the time do not understand the issues of central and southern Illinois folks, and so when we pass this legislation and then we turn around and see it being implemented, and you say, oh, my God, I did that.
I believe I did that.
And as a result of the people complaining about whatever services that are needed, and you turn that into a reality,
Right.
And so that's the beauty of this darn job here.
It is. It's sometimes it's amazing, and you just sit back and think about, wow, this is really.
I did that. I made that happen.
This is really, one of the other things that I have been working on since I've been here, and Senator Collins, I think that you would really appreciate that because of your background as a healthcare worker, is looking at some type of pathway for individuals, because we really need to look at staffing and how we bring more people into healthcare and the work that healthcare workers do.
Yes.
And so looking at how we can get individuals interested in the work, but how it can benefit them and their families, and build a ladder and of how they can come in as a so we looked at how we can pass some legislation around medication aids.
Mm-hmm.
So to take some of that work off of, because our RNs and LPNs
Yes.
were being asked to do more and more and more and more.
Right.
And there just wasn't enough time in the day, and there weren't enough of them on staff to do all of that. So by adding those medication aids, that brings in another staff person that provides, raises up the staffing levels. But I think it also provides individuals a pathway to a better life and a better career path.
Right.
So you come in as a medication aid, and then if you like that kind of work, you can look at becoming a CNA, and then an LPN, and then an RN, and then just keep working your way up the ladder. So those are the things that you try to think about, and think about how you can have an impact on your community and on people's lives from an economic engine, as well as providing good healthcare outcomes.
Right. And so, talking about, pretty much long-term care, SNL, education, the career pathway, that's something that we really need. I would say that one of my biggest passions here, it is healthcare, because I come from that industry. I worked in a nursing home for about a little bit over 11 years on a memory care unit. And then I worked part-time at a hospital, a safety net hospital.
Okay.
Until I couldn't anymore because it was just too much. And then trying to balance that with being a mom. But I would tell you that I know this industry in and out. And so one of the reasons why I, was really pushing so hard for nursing home retaliation, and I thank you all again for supporting that, because oftentimes, just working in that field and, working with seniors and, there are some really good people who are there. I think that you have to have compassion baked in your DNA to do that type of work.
It's not easy work.
Very stressful.
Yeah.
I mean, doctors who come to visit, they're overloaded with work. The nurses, they're overloaded with work. CNAs, everybody has a role to play in order to take care of our seniors in long-term care. But there are some isolated incidents that do take place. And, my advocacy for our seniors is that I've been there, I've worked there, I've seen it up close and personal. And I was also a shop steward. So a shop steward is pretty much a representative for your coworkers. You pretty much just enforce whatever labor agreement contract you have.
I see.
A lot of people thought that you were defending the worker, but you were actually enforcing a contract. And so, doing it on top of the work and just, being a part of investigations, learning how to, represent workers. Like I said, I've seen things, and, me being who I am and taking an oath to, defend our seniors and advocate for them. This bill was really important to me, and that was House Bill 2474. It's the nursing home retaliation bill. And so just to see how we were all able to come together to put those protections in place and keep seniors' voices centered, I think that also improves their quality of care, and it also makes them, feel seen. Because what you hear from a lot of seniors is that people forgot about us. People don't see us, and they go into
long-term care facilities.
They go into depression. They start to feel a little bit isolated. That has a wear and tear on their health as well. Especially if you're on a memory care unit, like you have to have training. You have to consistently have training to work on that unit, just to know when a patient is having a sundown moment, right? The changes in behavior when they're in and out, and being able to just address them in a way where they feel comfortable. Because sometimes they look at you, depending on how far along that disease is progressing, they'll look at you as a stranger, and then they become combative. And so you have to be well-trained, have compassion, and enough skills to be able to deal with that. But there has just been cases where I've personally seen where some folks just don't belong in healthcare, in my opinion. But I think this bill does give them a voice. It does make them, feel like, hey, I'm human, I'm here. This is my home. And since I got to be here, I want you to respect me and address my needs. And so I think the state of Illinois, what we've done here is that we have been the leaders of some very important legislation, national legislation, rather, a model for other states to follow. And so, and that's just due to the work that so many of us have taken lead on.
Well, see, that's the important three branches working together, because yes, we have been a leader.
Yep.
Matter of fact, for the country, because a great deal of the Affordable Care Act, they call it the Obamacare, came from right here in Illinois.
It was Obamacare.
It came from right here in Illinois.
Yes,
And so what they did was when Barack went to and I had the pleasure of working with at that time Senator Barack Obama when I came in as a freshman. Barack was the chair of Health and Human Services Committee. They were both combined at that time. Okay. And so I, as a freshman, was appointed as the vice chair, And so I was sitting next to Barack, and he would say, I would try to talk. He said, Ellie, don't say nothing, be quiet.
Wow.
Yeah. And so I had that pleasure of being his vice chair of the Health and Human Services Committee. And, we here in Illinois, we're the leaders for the country as far as I'm concerned. We get invited to speak all over the country, attending different conferences and educating people on how we did it, and it has a lot to do with the cooperation of the branches. We work very closely with the governor's office, and, we don't agree all the time on different issues, but eventually, in the final analysis, we all come together.
Exactly.
And that's the beauty of it. You make it happen.
And the impact that it have on everybody's lives, right?
Impact, yeah.
And I think when we talk about, just Black maternal health or Black, health equity, so what I would love for the masses to know is that when we address, Black health equity, it don't just lift us up, but it lifts everybody else up. Everyone else benefits from it, right? And so whenever there's a new clinic that pops up in Decatur, everyone else benefits. A healthy person is a healthy community.
Right.
And we know that all of these other, social determinants, if we don't address them holistically, which we've done that here in the state of Illinois, it actually improves. And it closes a lot of those life expectancy gaps.
No, you're absolutely right. And I've seen that because one of the things that I worked really, really hard on when I was at the Department of Public Health is cultural competency training for healthcare workers, for from physicians, all the way down. And but when you provide that training and you allow healthcare workers from all across the spectrum to be better trained in how to relate and provide services to their patients, they are taking that same compassion, that same ear for listening, same eyes for seeing, and same walking into someone else's life journey. They're taking that to every patient,
right?
Not just the Black and brown patients. They're taking that to every patient. So it really helps them to become better equipped to deal with all of the patients that they're going to come in contact with.
Well, that cultural competency training, it's the same as the implicit bias. You got to educate people, and you may have gone to school, all of us, and we specialize in particular areas, and we specialize and we work with everything, but we don't know how to treat people.
Right.
No one teaches you how to treat people. And how you want to be treated, And so that's where the cultural competency comes in, with the training as well as cultural bias training, And that's why folks specializes in those particular areas to work with professionals in these fields, particularly the medical staff. You have to be sensitive to the needs. You don't know what their housing conditions are. You don't know anything.
And let's stay there a little bit because I seen a video. I'm a millennial, so I watch Instagram. But there was a video on Instagram where a Black doctor, where she talked about how to talk about your pain to your doctor to get them to actually address the pain and not spin you around in circles. And oftentimes Black women, we know our body. So when we go to our healthcare professional and we tell them, hey, I'm having this pain in a certain area, whether it's my shoulder or my left side or whatnot, we expect for them to be able to tell us because they're the experts, right? But oftentimes they'll say, oh, well, this is probably due to weight gain. This is probably due to that. Or, it is never taken to the extent as it would with our white counterparts.
Right.
And oftentimes women die from, things that could have been prevented.
Right.
And that goes back to maternal care, right? And so it was just interesting in some of the slides that she showed where you have to say that I'm over a 10 when it comes to pain.
Yeah.
It's been consistent. I can't walk. I can't sleep, in order for the doctor to respond and say, okay, I'm going to look further into this really quick. So I went back and forth to my healthcare providers for almost maybe 5 years, close to 7 years. And I kept complaining about the weight gain because I kept gaining a lot of weight and I didn't know why because I wasn't a big eater anyway. And I had problems with a consistent menstrual cycle. I would probably come on like maybe 3 times or something like that. I'll be off for like 4 months, come on for a whole month, and And so I started getting acne, which I never really had acne at all. And then I started growing like little chin hair here and there. And so I knew something was wrong, and I had PMS like 24/7.
Right.
And I already got an RBF face, so But it really wasn't until I met a doctor who actually had PCOS, polycystic ovarian syndrome. And this is something a lot of times that go unchecked in our communities because the first thing the doctors say is, you're just overweight, you got to lose weight.
Right.
And that's what I was told all those years. And I'm just like, wait a minute, it's okay, got to be more than that because I'm in the gym, I'm on this diet, nothing's really happening. I keep going up and down. I mean, my face is really big, and this one is really small. Like, what's going on? But when I met with her, she said, asked me all these questions. And she's like, I'm going to check your ovary. And, she checked my ovaries. She called me back in. She said, it's PCOS. You were blessed to have kids because most women can't have kids. And she said, you can't tell if a person has PCOS just by their outer, body structure. She said, because it's your hormone. Your hormones is all over the place, and we got to get them back on track.
Right.
And so long story short, I say that to say that I went through multiple different doctors complaining about the same exact thing over and over again, which put me into some depression.
Oh, yeah.
And it made me think, like, was this all in my head? But I know my body. I know, you know what I'm saying? And so now I feel a lot better because I know more about it. I know that it's not an obese thing that smaller women, more petite women can have it.
Right.
It may show up a little bit later in your life, but it is a serious thing because it's packed with so many different other issues that can arise if it goes left untreated, like insulin resistance, endometrial cancer, all types of things. And so,
But
yeah,
what that tells us is that we have to really be more active about being our own best advocate.
yes,
And we have to talk, as Black women, we have to talk to each other and talk to our sisters, talk to our kids about being our own best advocate.
That's true.
And not, and making sure that your voice is heard
correct.
when you're talking about your health. Because, your health is your wealth. If you don't have your health, you can have $1 million in the bank, but if you're not healthy, it doesn't matter. So we have to be our own best advocate when we talk about that, and don't take no for an answer.
Correct.
And just keep pushing and keep pushing and just say, well, I'm sorry, but are you understanding what I'm saying to you?
Yes.
You need to refer me, please, to a specialist. And we just have to be persistent about that.
And sometimes, especially in our community, that's difficult because, there has been such a long history of us believing that the doctor was like the smartest person in the whole world.
Right.
And whatever the doctor said, that's what it was. And you didn't push back on that because he knew what he was talking about. But one of the things that I worked really hard on when I was at public health and I know people get tired of hearing me say that when I was at Public Health, but was having, really having classes and sessions and teaching people how to be their own advocate and how important that personal relationship is with your doctor.
Right.
And if that's not working for you, then you need to move on and find another
relationship. Not working.
So in spite of, I guess in terms of wrapping, in spite of all of the work that we do,
there's still work to be done.
There's a whole lot of work that has to be done.
Yes, ma'am.
And this is just the beginning, but we're doing a good job, with it. So,
but I can say that we're equipped for the journey.
Absolutely,
yeah, we're equipped for the journey.
And in the, it's Black History Month, and there was a lot of Black women who fought. And I always tell people we are an ancestor's dream, right?
Absolutely.
We're bringing doulas back. We're bringing midwives back. We are creating these safe spaces for women to be able to.
Minister Journey through those other powerful Black women back in the 17 and 1800s. Everything that they worked for and advocated for, this is what our job is. We're doing through this way.
Well, I love doing it with you two ladies. And so thank you so much for your leadership. And we're going to wrap it up. And happy Black History Month from three of the most amazing women in the Senate. Leader Hunter,
yes,
Senator Turner, and Senator Lakesia Collins. And we're out.
Thank you.